If you've learned your pregnancy is high risk, it might sound frightening at first, but the doctors here at Valley Care Clinics have ample tools and training to ensure a safe birth.
High-risk pregnancy is any pregnancy that has another medical issue with it that complicates the health or the well-being of the mother and or the baby. High-risk pregnancy can include stuff like gestational diabetes. It can also include epilepsy, it can include kidney disease, it can include thyroid disease. All of these can affect the pregnancy in a negative way. So what we are here to do is to balance out all those medical issues to make sure that there's a proper outcome in both the pregnancy and the health of the mother and the baby. Patients that are at risk of such high-risk pregnancy are those that have already had a history of such a pregnancy. Patients who've had preterm labor in their history, for example, are at a risk of having another preterm birth. And what we want to do is to prolong the pregnancy for as long as possible and to prevent preterm delivery, if at all we can. The biggest social issue that I see right now in the Valley is the access to prenatal care. You know, so many people that I've met in the short time that I've been here have gone through the entire pregnancy without any prenatal care. And the biggest reason that they tell me is because they didn't have insurance. So they just wait until they go into labor, and then we meet them on labor and delivery. They've had no prenatal care, which puts their pregnancy at great risk. We have a general protocol that we follow through the ACOG guidelines. And there's different changes and different steps that we need to take depending on what the high-risk issue is. So every patient has to be treated a little bit different. There's not one general protocol that you have for every high-risk patient. I always say that in pregnancy, I view it as a partnership between the mother and the physician, because the only way you're going to have the best outcome is if the patient is following your instructions and we're communicating well.
In addition to obstetrics and gynecology, Dr. Nimoy also specializes in minimally invasive robotic surgery.
I specialize in minimally invasive procedures. For example, I use the Da Vinci robot to do all my hysterectomies and GYN procedures. And what that allows us to do is do major operations through small incisions. It's a major benefit to patients. They're able to get in and out of the hospital in such a way that I can send them home either within hours or the next day, and their recovery time is quick. South Texas Health System has built an outreach clinic in San Juan. I rotate through there also. Patients can call for information, they can walk in, and if they want to be seen at the San Juan clinic, they can also call that office. My office is open from 9 to 4.
Now it's time to take into consideration the decisions and options for high-risk births and to discuss your personalized birth plan. Come and visit Dr. Nimoy at Valley Care Clinics in McAllen and at STHS Women's Center in San Juan.